Let's go again.
Alex, are you ready to pod?
Are you ready?
Yes, but I only have time for a quickie.
Let's go.
Let's get a sound check.
Ready.
This is Alex J. Aguiar, and you're listening to a Pod or Two Quickie. On today's Quickie, this test prevents death. February is Heart Awareness Month, and in honor, one simple test that will prevent you from having a heart attack. And it's really sad that some places don't even mention this test to you. But on the pod, we're going to tell you all about it. It's called a coronary artery calcium screening, or calcium CT scan. To shed some light on this test, here's Dr. Nathan Ritter.
I'm Dr. Nathan Ritter from cardiogauge.com. I'm a cardiologist in New York. Coronary artery calcium scoring. This is a test that shows how much calcium is in the arteries that go to the heart. It's a marker for atherosclerosis. So if there's a lot of coronary calcium, that implies that there's coronary artery disease, which is basically made up of cholesterol buildup on the sides of the arteries. And then over time, calcium gets put on top of the cholesterol buildup, and it's an indicator that there could be a problem. The way the test is done is a person goes through a CT scanner, and they basically have to hold their breath, typically while the scan's being done. But it's really quite simple from a patient perspective. It generally costs from $100 to $700. Where I'm at, it costs $100, but it would be possible to get ripped off and be charged $700, I suppose. The insurance companies generally don't cover the cost of the test. The main use for this test is to decide if a person has high risk for getting a heart attack or angina or stroke or stent. It's to predict if a person's going to have a problem. So if there's a lot of coronary calcium, the person's got higher risk. If there's no coronary calcium, the person's at lower risk. And frankly, the most useful aspect of the test is if you have a coronary calcium score of 0, then you're at very low risk. So for my patients, I'll generally use it in somebody who appears to have moderate or high risk for blockage based on statistics, just their age and their blood pressure, whether or not they're a smoker, etc. And to take that person and do the calcium score, then you know about their risk a lot more. General doctors will often put numbers into the computer and basically get a recommendation of whether or not a person should be on a medication, and then offer the medication to the patient. So that happens all the time. There's so many millions of people who fall in the category of being intermediate to high risk, and a lot of people are dissatisfied with that, understandably, and would like to know better what their risk is. So that's a person where the calcium score really comes into play. So we do the calcium score. If it's 0, then that person's risk is really low. You got no calcium in your arteries when you're 45, 50, 60 years old. That's a really good sign that over the next 10 to 15 years, it's unlikely that you would have something bad happen to you. So it's a pretty useful test, and in quite a few patients, I find that it's helpful. I've had patients go both ways with it, where they'll have a score of 0 and then we don't have to worry about treating. And then I've had patients who will have a surprise, very elevated score, and then that motivates the treatment. What are some drawbacks? There are two main drawbacks from my point of view. Number one is you get radiation when you have a calcium score, and believe it or not, it's about somewhere around a year's worth of radiation that you would get naturally from the sun. And so that, when you hear that, sounds like a lot. It is a fair bit, but it has very low risk as far as we know. It's not something that I could prove to you was entirely safe, but we just don't see a signal that a radiation dose like that is going to change somebody's outlook frequently. So it would be very unlikely for it to cause cancer. But it is about a year's worth of radiation. In some places they could do it with less, 6 months or 3 months worth of radiation, but it's on that order of magnitude. The second thing with calcium scoring that I see, which is a drawback, is it can make people worried, make people anxious about having a stroke or heart attack more so than they already were. So they were hoping for reassurance with the calcium score. They were hoping for a 0, and instead we got a 70 or a 200 or something, high. And that would indicate that they should do something different with their lifestyle and possibly take medication. But they worry about the idea that there's calcium in there and constantly worry that something bad's going to happen to them, and that all that worrying and anxiety is a very negative thing. I've seen that happen a couple of times where ultimately we decide, geez, it would have been better if we didn't know that. But bottom line is, it's better to know than not know, generally, for something like this, because it's such a common problem. I've ordered calcium scores on people in my family. I've recommended it for multiple people in my family because there's a family history of coronary blockage. So we use the calcium score to see if there was high enough risk to warrant medication.
Thank you, Dr. Nathan Ritter. I believe everyone should take this test. Why? Because it can save your life. For more on Pod With Me, if you have not done so, go to the App Store and download our app. You can also go to alexjaguiar.com, and we are also on social media. On Facebook, you can go and follow us on Pod With Me, AJA. On Twitter, it's Alex J. Aguiar. And on Instagram, it's Pod With Me. This is Alex J. Aguiar, and thank you for listening. And remember, don't fall off the pod.
Let's get a sound check. Ready.